San Diego, California. Its population, 34,500 residents. Male to female ratio, 60-40. Bachelor's degree or higher is 51%. Average income, $73,756. Nearly 90% of downtown residents do not have children living at home. 60% of the residents are between the ages of 30 to 34. Downtown San Diego is roughly 76% renters. Downtown San Diego is also home to the San Diego Padres. San Diego is also home to the Gaslamp Quarter, with 16 walkable blocks packed with over 180 restaurants, 50 bars, and 10 nightclubs. Downtown San Diego might appear to have fewer homeless people during the day, but the number of people sleeping on sidewalks and tents and vehicles at night has continued to grow over the past few months. Since January alone, the monthly census has shown a 68% spike in street homelessness downtown. The count peak at nearly 2,000 in August has since hovered around 1,130. More tents line city blocks and more homeless people cluster near freeway, on-ramps, business, and homeless services. Last year, San Diego was ground zero for a deadly outbreak of hepatitis A that spread up the coast of Santa Cruz, leading California Governor Jerry Brown to declare a state of emergency in October. By January 24th, the San Diego County Health and Human Service Agency reported that 577 cases, including 20 deaths and 395 hospitalizations. Now in downtown, the city has mass cleanups once a week, more resources, free health clinics to prevent another outbreak, and had to build an industrial-sized tent house for the homeless and hope to gradually move them to permanent housing. Downtown San Diego has 12 churches on the outskirts of the city. It is normal for the churches to be away from the center since it's not really family-oriented. It is also considered a food oasis with a large number of healthy restaurants and only a handful of fast food choices, fresh food markets, and weekly farmers market where people have the best possible access to healthy options. Just 12 miles east from downtown San Diego is my home, Lemon Grove, California. Its population, 26,421. Male to female ratio, 45-55. Bachelor's degree or higher, 16.3%. Average income, $58,694. 67% of residents have children living at home. 54.8% are homeowners. Medium age, 37. Homeless population, only 52 people. It is also home to 6 community parks and a dog park. Lemon Grove is also considered a food oasis with a handful of fresh food markets, 2 farmers market, which is affordable to the community, and a handful of freshly vegetables pantries. Churches and spiritual outlook in Lemon Grove, California. There is 19 churches, and the churches within the community provide one of the farmers markets. They provide pantries as well as resources and outreach programs. Lemon Grove versus downtown San Diego. Some of the differences are Lemon Grove is family-oriented, 3 health centers, 3 bars, 1 hotel, 1 motel, 44 restaurants, 16 schools, which are public, trolley stations, 17 churches, multiple parks and playgrounds, pantry, and 4 resource centers. Downtown San Diego is more of a single living environment, 3 hospitals, 3 clinics, limited parks, over 180 restaurants, 50 bars, 10 nightclubs, 54 high-end hotels, 3 motels, 14 schools, which are private, and 1 community college, trolley station, limited churches, over 1,000 restaurants, and limited street parking. Some of the differences between Lemon Grove and downtown San Diego is race or ethnicity. In Lemon Grove is almost 45% Hispanic and 35% white. In the contrary, downtown San Diego is 45% white and 30% Hispanic. Unemployment by industry. Most of the residents in Lemon Grove, California fall into healthcare and social at 12.5%. and retail trade at 10.7%. In the contrary, downtown San Diego falls into the healthcare and social at 11.9%, with the highest of professionals in the scientific, tech, and services, 13.2%. The report Annual Crime Rate in Lemon Grove shows most of the incidents happen between property crime and theft. In the contrary, downtown San Diego has a large number of violent crimes and theft plus property crime. A report done in San Diego County found that 23% of Hispanic kids are obese. That's almost twice the rate of non-Hispanic children. The prevalence of obesity among low-income children was also 23%, more than twice the rate from wealthier families. The health impacts of obesity: prediabetes, diabetes, fatty liver disease, sleep apnea, asthma, high blood pressure, depression, anxiety, and a lot of children that experience obesity suffer from bullying. San Diego as a whole has put an initiative called the Communities Putting Prevention to Work (CPPW). Is designed to make healthy living easier by promoting environmental changes at the local level. Through funding awarded by the Center for Disease Control and Prevention, a total of 50 communities are working to prevent obesity and tobacco use, the 2 leading preventable causes of death and disability. To decrease the prevalence of obesity in San Diego County, they have increased access to healthy foods for more than 6,000 low-income residents by encouraging farmer markets to accept electronic benefit transfer (EBT) cards as form of payment. It also launched a new farm-to-school lunch program in the San Diego Unified School District. Through this program, more than 72,000 healthy lunches featuring fresh food from local farms are provided to public school students each day. It also created a public health stakeholder group composed of multidisciplinary experts that ensure physical activity and nutrition are incorporated into all aspects of public planning, including land use and transportation.